It's interesting how often I get to say, and now for something completely different. I've been asked to talk to you about what I know, or share with you what I know about informal caregiving in Canada, or the informal care workforce. And this is the last time you'll hear me use the term informal, because in our experience, the so-called informal caregivers are offended by that term, implying as it does that this work is casual and easy and unimportant. So I will use the term family friend care or family care throughout. I'm really pleased that Carol and Howard asked me to come and talk with you about this often very hidden part of the care workforce. Because it actually is a significant workforce. Carol was right when she said that there's an imperative around keeping people who need care at home in the community as long as possible. The implication of that, of course, is that it means higher demand for care on the part of family members and friends and neighbors. Howard asserted that care is or should be at the heart of any dementia strategy. Well, if that's the case, then it means that family care should be at the heart of that heart. In 2012, 28% of all Canadians aged 15 and over were providing care to at least one family member and friend, and many of them were providing care to more than one person. There were 8 million such caregivers in Canada in that year. They provided, according to some estimates by the Conference Board of Canada, 15.5 billion hours of care. And that amounted to 10 times the amount of care provided by paid caregivers. So this invitation actually gave me an opportunity to drill down in some of the data that I've been using from the Statistics Canada General Social Survey that was done in 2012, from which these data come, on caregivers who are providing care specifically to people with dementia. By our calculations, there were 480,000 of those caregivers in 2012, and they averaged about 14 hours of care per week. The average for all caregivers was in the neighborhood of 5 hours per week. So the job of providing care to persons with dementia is clearly more demanding. We also had an opportunity to compare the population of caregivers to persons with dementia with all caregivers, and we find that they are older, spending more time on care tasks, as I just mentioned. They're more likely to be caring for parents than other relatives or non-kin. They are less likely to co-reside with the care receiver, and not necessarily because they're in residential care, but because they're living on their own in the community. And perhaps most importantly for the rest of my time, they're more likely to report many of the negative consequences that caregivers are likely to report. We know that caregiving comes at a cost to caregivers. We know that they report economic, health, and social consequences of care, and I'll share some of that information with you in a minute. But we also know that the consequences that caregivers experience spill over to other stakeholders. They spill over to employers in the labor market because of the implications for caregivers' employment. We know, for example, that between 30 and 35% of the Canadian workforce are caregivers. it also, their consequences also spill over onto the formal health and continuing care system, because they themselves can become ill or injured as a result of their caregiving responsibility, but also because if they are unable to continue to do their job, it's more likely that the person that they're caring for will be institutionalized. So looking at some of the consequences, as an applied economist, my particular interest is in the financial consequences of caregiving, and I've spent a lot of time looking at these consequences. High rates of absenteeism on the job among employed caregivers. Many reduce the hours of work that they would be putting in if they can't manage their care responsibilities alongside their full-time employment. A small but important proportion, around 10%, leave their jobs altogether because they can't manage both. In addition to those consequences, which of course have implications for income and benefits and those kinds of things, they also are more likely to spend money on the needs of the caregiver or in, things that buy time for them to provide care to the person receiving the care. And the result of all of that is financial hardship for some. We know that there are health consequences to providing care. We know that there are both psychological and physical health consequences. Caregivers become injured, caregivers become ill because of the stress, the lack of sleep, the inability to provide, care for themselves through healthy behaviors. And we also know that there are high rates of reported social consequences, less time spent with family members and friends, less time spent on getting out into the community to engage in social activities, and the end result for some is loneliness and isolation. So what does this all mean? Well, I've spent a fair bit of time also looking at the implications for employers in the labor market. There have been reports of a lot of turnover. As I said, some people give up their jobs entirely. High rates of absenteeism mean that there are many days of absenteeism attributable to specifically to caregiving. Again, according to the Conference Board of Canada, care-related absenteeism accounted for about 10% of all absenteeism in the labor force. And cost Canadian employers nearly $1 billion in 2007. Many fewer hours worked by those who have reduced their hours of work in order to provide care, and additional health benefit and other costs for employers when their employees rely on employer extended health care benefit plans. Implications as well for healthcare services. Caregivers themselves seek more healthcare services as a result of illnesses and injuries on their caregiving job. But we also know that family care reduces reliance on the formal healthcare system. So when caregivers are not able to maintain their family member or friend in the community, they are more likely to become institutionalized. One of my colleagues at the University of Toronto has estimated the aggregate savings to the healthcare system at $4.4 billion, directly attributable to family care. All of this basically, I think I can make two major points. One is that family care comes with costs. Those costs spill over onto other stakeholders. And the bottom line for me is that making sure that the family care sector is sustainable will be critical going forward to make sure that the formal care system remains sustainable. And that's going to require some serious attention to our health and continuing care, labor, and income security policy going forward. Others have already noted the kind of piecemeal nature of the set of policies to support caregivers. I think we can do much better. We need more coordination of the policy approaches to supporting caregivers in order to support the formal care system as well.